Just recently had a follow-up with one of my patients, Mark. I performed PRP injections for treatment of multiple issues in his bilateral knees 8 weeks ago, and we're going to give you an update. Good evening, Mark. How are you today?
Hello, Dr. Goyle. I'm good, thanks. How are you?
Doing well, thank you for asking. So this is a follow-up visit, 8 weeks after we did your PRP injections for your knees. That was performed April 29th, and I was treating your knees for osteoarthritic pain, as well as for some meniscal issues and some MCL, medial collateral ligament and lateral collateral ligament issues. And I just want to check in and see how you've been doing since then.
I guess the easiest way to explain it is that it's been so good that I have kind of forgotten about my knees.
Oh, that's
And
fantastic. Yeah.
what I mean by that is my knees were so bad because I knew you were going to ask me that question. So when I put my socks on or underwear in the morning, I could not stand on one foot and balance to be able to do that. I always had to lean on something or sit down. And my knees have gotten so strong that I don't have to do that anymore. So it's amazing. So yeah, awesome.
That's fantastic. And that was after one treatment, which sometimes, yeah, you had some pretty advanced osteoarthritic changes. So that's really remarkable. So what about activity wise? Are you getting back to mountain biking and hiking and doing the things you love?
Activity wise is equally as great. When I used to ride my bicycle or my stationary bike, the first 10 minutes was just trying to get through the pain. I guess what you'd say is getting the knee warmed up, or the knees, both of them, just so that you could ride. And now I don't have to do that. I get on and I can go, full force from the second I get on until I'm done.
Oh, that's
It's
fantastic.
amazing.
Yeah, that's great. How was the procedure experience for you?
All in all, it was awesome. You told me that I would experience some pain, and I'll be honest with you, I was kind of like, oh yeah, right. But all in all, with everything that happened in your office and the way you guys made me aware of everything, and was awesome. The only thing was the night of was, it wasn't like horrible pain. It was just discomfort.
Sure.
But I think it took me all weekend to, kind of feel normal.
Okay. And that's about right. I typically, when we do these PRP procedures, there's an inflammatory reaction that happens, and that can last anywhere from a day or two up to a week, and sometimes even a couple of weeks. So, yeah, that's great that it only lasted a few days.
Yeah, all in all, everything was awesome. And thank you guys again.
Oh yeah, no, our pleasure. So from here on out, keep on being active, do the things that you love, do your knee exercises. You want to strengthen your quads and the stabilizing muscles around that joint. And then I would say let's follow up at the 4 to 6 month mark, and we'll check in again. And given the degree of osteoarthritis you had, I would say in 6 months, I would recommend repeating this, whether you have pain or not, just
Okay.
stay ahead of it. So we can talk more about that. Maybe we'll do a follow-up at the 4 month mark. So in another 8 weeks or so, and then check in and see how you're doing.
Okay.
Okay. All right. Well, I'm glad you're better.
Thank you. Thank you guys again very much.
Yeah, you're welcome. Our pleasure. So I'll have my assistant schedule you for another 2 month follow-up from now. Okay.
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 Look
You take care.
forward. Thank you.